Pharmacy Pearls, drug therapy that works.
People often ask me if they should get the shingles vaccine. It represents a difficult choice for patients, as it is often not covered by drug plans and costs about $200. On today's episode of Pharmacy Pearls, I'll summarize the existing evidence for the shingles vaccine so that you can decide whether or not it's right for you. Much of what we know about the shingles vaccine comes from two large industry-supported, randomized controlled trials comparing the shingles vaccine with a placebo vaccine. The first study was published in the New England Journal of Medicine in 2005. It included 38,546 patients with healthy immune systems aged 60 and older and reported outcomes 3 years following vaccination. In the placebo vaccine group, 34 people out of 1,000 developed shingles over 3 years. By comparison, in the shingles vaccine group, 17 people out of 1,000 developed shingles over 3 years. The study authors emphasized that the shingles vaccine reduced the incidence of shingles by over 50%. This is true relatively speaking. At the same time, in order to prevent one case of shingles over 3 years, 58 people aged 60 and older had to be vaccinated. This study also examined the effect of the shingles vaccine on post-herpetic neuralgia, which is a painful condition caused by damaged nerve fibers that lasts for a long time after the shingles rash is gone. In the placebo vaccine group, 4 people out of 1,000 had post-herpetic neuralgia over 3 years. By comparison, in the shingles vaccine group, 1 person out of 1,000 had post-herpetic neuralgia over 3 years. This means that, in order to prevent one case of post-herpetic neuralgia over 3 years, 362 patients aged 60 and older had to be vaccinated. The second study, published in the Journal of Clinical Infectious Diseases in 2012, studied 22,439 adults with healthy immune systems between the ages of 50 and 59. It followed patients for only 1.3 years, but when the results were converted to 3 years, it revealed that in order to prevent one case of shingles, 71 people had to be vaccinated. To summarize, your risk of developing shingles increases with age. For every 1,000 people ages 40 to 64, there are 3 cases of shingles per year. For every 1,000 people aged 75 or older, there are 7.5 cases of shingles per year. Bottom line, over 3 years, the vaccine will prevent 1 case of shingles for every 60 to 70 people vaccinated and 1 case of post-herpetic neuralgia in 360. At this time, there are a few remaining questions about the shingles vaccine. For one, its long-term benefits are unclear, such that we do not know if a booster shot will be required in the future. Additionally, we do not know whether the vaccine is effective in people with a previous history of shingles or in people with compromised immune systems, such as those on chemotherapy. That covers it. Hopefully this has clarified the existing evidence for the shingles vaccine. If you enjoyed this video, please hit like and subscribe to my YouTube channel.